Ladies and gentlemen, welcome and thank you for joining today's conference, Health Innovations at Work mini sessions. Please note that all participation lines will be muted throughout the call. If you require technical assistance, please send a note to the event producer through the chat feature of the WebEx. With that, I turn the call over to Nurse Jessie. Please go ahead, Jessie.
Thank you, and welcome everybody to our Health Innovations at Work mini session, Designing for Health, a campus-wide approach to well-being. These mini sessions are virtual gatherings on topics that you've asked us to learn more about. In every registration session, we ask you, what would you like to hear more about? So your input is really crucial in developing our next few mini sessions as well. We hope that you enjoyed today's mini session. It is available via recording for you to listen and maybe even take a lunchtime walk. So without further ado, I'd love to welcome our guests today, Crystal Wohler and Dr. Bruce Robertson. Crystal has been employed as a Senior Director for Health and Wellness Services at St. Norbert College since 2016 and is responsible for overall vision and operations of the department, including wellness strategic planning processes and assuring integration into the college strategic plan. She develops and maintains community partnerships in communicable disease prevention, epidemiology, and community disaster planning, as well as the assessment, planning, implementation, and evaluation of health services on campus. She has an extensive public nursing background and is also completing her master's degree in business administration at St. Norbert College. Dr. Bruce Robertson is the Senior Director of Counseling and Career Programs at St. Norbert and has been since 2012. He oversees both counseling and psychological services as well as career and professional development. He is also a member of a senior leadership team, behavioral intervention team, and is also involved with numerous strategic initiatives in program development. He is also a licensed consulting and supervising psychologist. Welcome, you two. And today we are peering into your journey to improve well-being at St. Norbert College in an effort that you guys have named Wellness by Design. And when I first met you two, I was really impressed with how you approached the design of this program with the students and the faculty of St. Norbert. It was a unique approach, and I just thank you for sharing your story with us today. With that, I'll turn it over to you, Crystal.
Sure. Well, thanks for having us. We're really excited to be part of this webinar. We actually, since I started here, Bruce and I have been tasked with, developing a culture of health and wellness on campus here. And it's really great coming together with a public health background and then with Dr. Robertson's clinical direct care background. We think that it is a very good match in delivering and influencing culture on campus. So we'll talk a little bit about where we've come from and where we're going. And really, we're only in the first, 2.5 years of this. And so culture change takes time. And so we definitely will share our journey with you. But just know that we don't have it all figured out yet, and we're just working through this. So I just need my slide deck.
You see it on the top.
Yep, I have it. Okay, great. So Wellness by Design is our initiative name. And what we're going to be talking about today is what this Wellness by Design initiative is on campus here at St. Norbert College. And then also we will be discussing the St. Norbert College wellness strategies in more detail. So part of our action plan, what are we doing? So we'll spend a lot of time in that because we both believe that what we're doing here on campus can be applied to any business. In any culture, whether it's in the city, in the county, in a college campus, in a business, an organization, all of these action steps are scalable.
Yeah, so as Crystal said, one of the things that we have always seen as part of our strategy, and when we were tasked with coming up with a wellness initiative on campus is the critical nature that it fits into the strategy of the college itself. So as this slide indicates, our division strategic plan, Wellness by Design, fits into and influences the college's greater strategic plan, which then in turn influences the community. So we really do see this as not something as just something that we're doing within health services or counseling services, but it really is a bigger part of the entire campus and truly does influence. We've seen that happening as we've started to do some programming and some different things within our strat plan, how the president and the president's cabinet have taken that on as something that they see as critical to the entire campus. And so they have asked us to kind of consider, and we're in the process of maybe getting it into the college's strat plan as well. So we see it, again, as critical to what we're doing individually, then what happens on campus, and then how the campus then is part of the entire community.
And truth be told, you know, our campus community, our students will be community members. And so when we are discussing with different organizations our initiative like discussion with Humana or any other businesses locally, we will be graduating the next, you know, community member and the next staff person at the organizations in our community. So the fact that we are introducing them to wellness while they're here on campus and influencing that within their daily habits and what they expect, it will be something that will carry through to the rest of the community.
Yeah, and I just wanted to linger here from the lens of the employer a little bit more and relate this to them. You know, when I heard you say, you know, division strategic plan, I often think about how, in my experience, wellness can kind of get off to the side in its own silo where it lives. And it sometimes does end up on strategic plans, but it ends up as a score on a biometric screening or something like that. And I really love the fact that you're seeing it really from this 30,000-foot view of the holistic person. And they're going not only out into the community, but utilizing the community resources and going out into the community, which is the same thing that we have within our employers and our employees, is that the whole person is to be considered. And we happen to have the privilege of having access to that person throughout the day. And so this is a really neat model.
Yes, we're very excited. So we'll talk more about that, Nurse Jessie, as we continue the slides. So before we embarked on this initiative, we needed to pull a steering committee together because it couldn't just be Dr. Robertson and myself, you know, planning this. But we definitely planned the framework and how we were going to roll it out, but we needed cross-representation from across our community, our organization, and so we pulled together a steering committee, a task force, if you will. And we developed together a vision, mission, and a set of values that would guide us as we, you know, did an assessment of our community and as we developed an action plan for our community. This is what we always go back to when someone says, I have an idea, we should do this. Well, does it fit into our vision, mission, and values? So you can read them here in really the 30,000-foot overview. We really want, this is our world peace, we want a supportive, vibrant, and active St. Norbert College community that is committed to wellness. Not committed, of course, committed to health, but that it's bigger than health. It's holistic wellness, and that's something that you mentioned, Nurse Jessie. So we are utilizing the 8 dimensions of wellness, and we'll go into that in a little bit, but really our values. We value coordination and collaboration. We can't do this alone. We're not staffed to be able to build this out by ourselves, and so we need our partnerships to make this happen. Not only partnerships across campus, but partnerships in the community coming to campus. And we did not create this. This was actually utilized by the Blue Zones Project. We want to make the healthy choice the easy choice here on campus. So developing healthy behaviors is easier when living and working and playing in a healthy environment. And so we'll talk more about strategies, but really our focus is on prevention and health promotion. So building and investing in prevention, of course, is going to allow people to live healthier and more productive lives.
So, as we mentioned before, when we began the initiative, we really considered two big, broad ways of looking at this. So our framework comes at, that you can see on the left-hand side, a public health kind of model, but also a service-providing model on the right-hand side. So we're really using both of those simultaneously. So the left side is a little bit more top-down, looking at the entire system and how the system influences what kinds of programming and the services you provide and so on. And then on the right-hand side is really more of the providing the services, what kinds of things, what you do individually with the person, with the group, and so on. So we're looking simultaneously top-down and bottom-up.
And so the 8 dimensions of wellness comes from SAMHSA, and the model on the left, like Bruce mentioned, is a public health model. So really, the way we go about this is first assessing the health needs of our community, and you can do that actually through a survey. We used the American College Health Association survey to get our data, but a business could utilize, the cohort results of your HRA and determine, okay, well, what are the needs of our population? You can do it by that information, and you can also do a subjective opinion survey as well. So we first have to listen to the people we're serving. What are their needs? And then from that, we need to focus on what's important. And so, again, we brought in our population and we said, okay, this is what we saw. These are the results. So what do you think is important? We can't focus on all 8 dimensions right away because we just don't have the manpower. So if you had to choose, what would be your top 3 priorities? And we allowed that discussion to occur. So they being our community, were really invested in moving forward. So from there, we chose effective policies and programs. So again, this is a public health model. So we heard from the people that we are serving, and then we researched, well, what are best practices? What should we implement to address the needs that were identified in the surveys and the focus groups? And so we created an action plan, and that's act on what's important. And that's the stage we're in right now. So we have an action plan. We'll talk more about that. But we're really working hard to implement those strategies. And then, of course, the next step is to evaluate. And so we haven't quite gotten there yet because we need to implement more, but it's an important piece. Like, we need to make sure what we're doing is effective, and if it's not, then maybe we need to pivot a bit and not change course completely, but maybe just tweak a few things. So 2 models that we're marrying together, the SAMHSA 8 dimensions of wellness, that it's not just physical wellness and it's not just emotional wellness, but it's environmental wellness, and intellectual wellness, occupational wellness, spiritual wellness. So all of those, and we can get you more information. Actually, I think it's on a slide coming up here.
Right, and Crystal and Dr. Robertson, maybe I don't want to throw you too off loop here, but when you have the focus groups, one is, do you plan to reconvene with them? And also, when you're having them, what's important for us to realize when we're having them? I think there's some fear when you gather people and ask them what matters to them or what they want. How did you guys navigate those waters, and what is the plan for moving forward with the people that either were in the focus group or new ones?
Sure. Well, we have a very great opportunity because our community, well, in any business really, stays hopefully, for more than 4 years. But our students they're here with us 4 years. Sometimes a little more, but not very often. So what we did is we brought together about 100 students, a little more than 100 students, and some faculty and staff in different meetings, and we went through a SWOT analysis. So after we did the data presentation, then we said, well, with that information, what are the strengths you see on campus? What are the weaknesses? What are the opportunities, and what are the threats? And with that, we documented everything that the focus group had indicated, and we summarized that information and actually embedded that in our action plan because it's part of the story. And so we wanted to empower the community to make that choice. Now, with that being said, when we have this action plan played out, we plan to do an annual report to the community. So this is what's been done based on your feedback and the survey results, but we're not done yet. We have more to do. So that communication back and forth on an annual basis will occur. Our plan is to resurvey every 3 years. And so we will do this process all over again. It won't be the same focus group. There may be the same students, but we can't promise that. And so we'll just call additional people together and just touch base. But that communication, at least on an annual basis with our community, is important to let them know where we're at, what things have been accomplished, what we're still working on, and that we are hearing from them. Bruce, do you have anything to add?
Well, I guess I would just reiterate what you said in that we really felt like we needed to get the student opinion, the student view, the student sense of what is wellness, first of all. So like Crystal said, we kind of gave an overview of where we're going, and then we allowed them to give us feedback to decide where we would start. From the focus groups, we got some specific information. Of the 8 dimensions, they felt like the ones that were most critical to them were the environmental dimension, the physical dimension, and the emotional dimension. So that's where we made the decision that let's start there. We wanted the buy-in from them in particular. We may have thought we wanted to start someplace else, but we got the student and a little bit of the faculty and staff in there as well, their view. As we go forward, our goal is to hit all of the dimensions, from year to year to year. So with that, our plan is we're going to want to probably insert some of those dimensions that may not rise to the top of the most interesting, because right now I think emotional and physical are going to probably rise to the top because they're the ones that people think about when they think about wellness. They don't think about things like necessarily spiritual or occupational wellness or intellectual wellness. So some of it is going to be an education as we go forward.
Did you notice how all the dimensions are number 1? That was just, I don't know how that happened, but there are 8. So.
They're all important. No, it's really good. I just wanted to say on that piece, you guys, I mean, just for the employers listening, doesn't that, for me, it has a sense of empowerment and simplicity that maybe we get lost in, like, we have to do so much and do, all these different interventions, but really it's as simple as gathering the people and what's important to you, and then reiterating, again, we're listening, and everybody can help and play a role in designing that and implementing it. And just pick 3. And that just has a feeling of, like, I can do this, maybe versus getting pulled in every different direction. So thank you for that.
Because it's so easy with 8 different dimensions how you can definitely get pulled. And our resources are limited, and I'm sure that in many businesses listening in, your resources are limited as well. So we have to institute some sort of priority. and listening to the voice of the consumer or your employees is definitely what we thought was important. And Bruce and I, we both feel we need to start small and think big, and that's our motto. So even if our vision is much bigger for a certain strategy, we have to start somewhere with our, and then once we have success in that, then we just expand it. And so my advice would be if you could just carry through that philosophy, I think you would move the needle in the right direction.
Right, so it's thinking big picture all the time. One of the unique things here on campus is that we really have all of the 8 dimensions covered in various areas. So just because we're going to focus on, say, emotional wellness doesn't mean we're not doing all of the other dimensions simultaneously. But our focus is going to be on these 3 areas. So what we've communicated across the campus is as we move forward, you're not eliminating anything, but you are focusing on these particular areas. And so then how do we collaborate with each other to focus on these 3 at this particular time in our history?
Mm-hmm. Right. So we developed an action plan because we need a roadmap, right? We need something to document what we're doing. And that's what I had mentioned before about researching best practice. And again, sometimes it's starting small. So one of our examples that we have implemented already is we changed out 2 of our vending machines on campus, and we have many. I'm sure other businesses have many as well. But 2 of them we are piloting to have 80% healthier options and 20%, we call them whoa foods, like red light foods, like don't have them all the time, sometimes foods. And so this has received, accolades from the students, because when they are studying and when they're busy and they can't get to the cafeteria, they just want something with some protein or something to fill them up and give them some brain power to get them through that study group. And so not only students, though, of course this is affecting staff and faculty. So we have an educational campaign that goes along with it, and like I said, we utilize the stoplight. Green foods are the go foods. The yellow foods are okay. They're slow, like don't have them all the time. And the red foods are the whoa foods. So we have an educational campaign that goes with this initiative. Again, starting small and thinking big. We only started with 2 vending machines and working with CONUP as our vending supply company, and they have been so receptive in working with us in this strategy. And we're seeing some great positive results, and consumer choice is driving, I think, the expansion in years to come. So we've only had this going for, it was just the spring semester. So just a couple months, and already we're seeing results of consumer choice.
Yeah, and I think it's kind of fun to watch the process happen because I would say even some of the individuals who are involved in this were a little surprised. Mm-hmm. I think even CONUP themselves were like, wow, the students are actually choosing the healthy choices because, it's all a business, and we're a business, they're a business, and we're collaborating with each other. But what we have found is the students are saying, now if you present this to us, we're willing to take it. And then we can use that to continue the education process to go forward, and then to say, okay, now we'd like to spread this maybe to other vending machines or other food possibilities on campus. So we get some small wins, which is really what we're trying to do in each of these areas that we'll talk about, is we're trying to get a small win, get that under our belt, and then use that to kind of propel us into the next level. And that's really exciting to see this happen. And the students are commenting on it, and it's just kind of a bit of a conversation that's happening on campus. Did you notice this? And, oh, there's healthy choices. And then we use that within our presentations and things like that.
Mm-hmm.
Yeah, and I guess I'd like to draw us to, we have about 5 minutes left here, but we'd like to, kind of highlight you guys' efforts in built environment and kind of how that ties into that emotional or mental well-being too. Could you speak to where you went with that as far as built environment and mental or emotional health?
Yeah, so our survey results, that's example number 4 on the slide. Our survey results indicated that stress and emotional wellness was very important to the students and faculty and staff as well. And so we wanted to not only look at the programs and direct services that we have available, but also how we can change environments and change policy, because that is going to get your biggest impact. So changing environments related to that, of course, research says that not only instituting mindfulness practices within an organization, but also creating spaces that allow for that disconnect, right? To just be and to relax and kind of gather yourself. And so Bruce, as the psychologist, can give a little more insight on that. But we feel that it's very important in our action plan, not only to focus on the direct care and services being provided, but also look bigger and change environments and influence policy, because the impact is so greater.
Yeah, so what we kind of did it in a number of ways. When we designed, we recently moved into a new space here on campus about 2 years ago, and we designed the space to allow for a relaxation room in counseling services. Whenever we give a tour, people come through, they see the space, they want a space in their space. They want to know how we could get something like that. They want to know about it. So even though we just have a space and it's used for relaxation, particularly by the students, whenever somebody sees it, it's an opportunity to have a conversation to say, how could you do this in your space? How could you take this home with you? Why is this important? And so on. We then have recently begun some more conversation about a relaxation space, a bigger one, because again, this is we started small and now we're kind of moving to the next level. We got some students who are really interested in partnering with us because they see the impact, the value of mindfulness and relaxation and yoga and things like that. So what we have done is we have an opportunity to write a small innovation grant to get a space on campus that we would utilize for mindfulness, relaxation, and so on. That space would be available to students, to faculty, to staff. And what we want to really see that as is a place where they can come, learn about mindfulness, get educated, practice it even, and then take that back to their space. So they can take it from the centralized space to residence halls, into the classrooms, maybe start the class with a mindfulness practice, something like that. And then kind of continue the process of growth. So we really do see this as starting small, like a small room in our counseling offices, our clinic, then moving it now to a bigger space, more centralized on campus, and then moving it across the campus into classrooms, into residence halls, and so on.
And so really what this could look like in any business, first of all, maybe creating a break room, if you don't have a break room, and allowing employees to go in there, depending on what resources you have available, with soft lighting. So if you have fluorescent lights, what we have done is, we've turned off those fluorescent lights, or if you have dimmers, that's even better, and then we just infused lamps for soft lighting. You could play music, you could get a small water feature, you could get a recliner, something just to allow people for 15 minutes, if they have that break time, to unplug and just take that moment for themselves. So it could be any space. And then, again, it's the philosophy, like Bruce said, start small, think big.
Mm-hmm. Mm-hmm.
Wow. So we're coming up on our time, and as you guys can see, we could talk a long time with you guys here. But as we kind of wrap up, I just wanted to let our listeners know that you ask some questions, and I will actually reach out to Bruce and Crystal and connect the people who had offered some questions up. And then you're going to get this slide deck, which actually includes a video as well. Bruce and Crystal have graciously are going to share their contact information with us. So again, just some how-tos and resources for your next step on this. So any last final words? I know we're at time here, but that you guys wanted to offer for our companies?
I think, just starting somewhere, but really listening to the voice of your employees, understanding their needs, whether it be from the results of their HRA and some subjective feedback, and then developing a small action plan. Start somewhere, start small, think big.
Yeah, that's awesome. That's awesome. Thank you, guys. What about you, Bruce?
Yeah, I would just kind of say the other thing that we have is always having an assessment of what is going on so you know where to go. So you've got the plan, then once you have the plan, then you can implement it. Without the plan, I think it ends up kind of being hit or miss and kind of bouncing around. You have the big picture always, and then you, again, like Crystal said, you start small, keep thinking big.
Love it. Love it. Well, thank you all for being here. We invite you next time to crush mental health stigma, move past overwhelm and analysis paralysis to action with none other than Medi Spies. If you haven't heard of her, she is absolutely the leading authority in talking about mental health. She's the founder of A World Without Suicide, so we hope that you will join us live or for the call recording on that. And our last question goes out to Bruce and Crystal, as we always ask, to get to know you better. Who would play you in a TV sitcom or movie? What did you come up with?
Well, I did a survey online because I didn't know, and the person that I was chosen to be, or person who is going to play me, is Emma Watson, and she is the actress that plays in the Harry Potter movies, and so I was surprised by that. I read a little bit more about her. I didn't even know who she was.
For me, I kind of did the same thing as Crystal did. The obvious choice was Bob Newhart. As a psychologist, pretty cool, he's pretty calm. Yeah. But he's always got this funny undertone to him, and that's what people have told me. But the other one, I did a survey as well, and Bradley Cooper came up.
Oh, wow, Dr. Arson. All right.
I know. Combination of Bob Newhart and Bradley Cooper.
Oh. Thank you guys so much for being here, and thank you all for attending today's Health Innovations at Work mini session. Have a great day.
Bye.
Bye. Bye.
That concludes our conference. Thank you for using AT&T Event Conferencing Enhanced. You may now disconnect.